Well, we're back with Dr. Napolitano, an optometrist. Dr. Napolitano, tell us, what is, kind of make a list for us of the most severe or all of the particular eye problems a person can have, and describe each one just a little bit. We're going to go into detail much later, but just give us the eye problems and the symptoms which occur with each problem.
Well, I would say one of the most common ones in my practice is definitely dry eyes. A lot of people don't realize they have dry eyes because they think that the symptoms associated with that, they're just normal. And they're not. Most common signs of having dry eyes, believe it or not, it's actually having watery eyes, having tearing. That's a sign of dry eyes, burning, itching, blurry vision, especially when doing near work, either using computer or reading for a long time. The other one that we obviously check every time we do an eye exam is glaucoma, which is actually the common cause of blindness in the United States right now. And glaucoma is caused by several different factors, but the only one that we can control is the eye pressure in the eye. When a person has high pressure in the eye, we initiate treatment to try to lower the pressure because that's the only thing that we can actually change right now. That's why it's very important every time you have an eye exam to have the eye pressure checked. Certainly, we also worry about diabetes. We always ask our patients if they are diabetic because diabetes can affect the vision, can cause blurry vision, but most importantly, it can also cause problem with the retina, which is the film in the back of the eye that sends the message to the brain that allows us to see. And a lot of times diabetes causes bleeding in the back of the eye. And many times the patient doesn't realize that there is any bleeding there because at the beginning there will really be no vision problems at all. So it's very important if you are diabetic to have your eyes dilated at least every year. Sooner if anything is discovered. In the older population, the other thing that we worry about is macular degeneration. Macular degeneration affects mostly people that have light color eyes, like blue eyes or green eyes. And it's a very devastating problem. It could cause blindness. And again, the best treatment for that condition is early detection and early treatment. So regular annual eye exams are extremely important, even if you as a patient don't notice any vision change. And the other thing again in the older population is cataracts. We all gonna get cataracts at some point. If we live long enough, we're gonna have some sort of cataracts. It's just a normal aging process. It doesn't happen at the same speed for everybody, obviously, but everybody's going to get cataracts. Cataracts, the biggest thing that it causes is blurry vision, distorted, fuzzy vision. Also, the colors are not going to appear as bright as they used to. And the best thing to do for cataracts at the beginning is just to have an adjustment in the eyeglass prescription. And many times that's just going to take care of the problem. Eventually, as the cataracts grow and they become more prominent, then the surgery is needed in order to improve the vision. I would say those are the more common eye conditions that I see in my office. And the other one also, especially during the spring or fall time, is allergies. And a lot of times, even if a patient has seasonal allergy and is already taking oral medication for the allergies, that doesn't necessarily take care of the eye problem. So sometimes a topical antihistamine will be needed to treat the eye allergies, and that's something else that we do here.
Well, you have explained lots of things, especially when it comes to allergy and those type of stuff. I'm sure most of us are really not aware of that, and even the red eye or the dry eye. Yes, I don't think I have any of those problems, except I cry at every little movie where there's a good, nice, fuzzy scene in it. But rather than that, but I do know lots of people who do run around and constantly, doing something with their eyes. And And many of them just, as I come to think about it, they say, oh, I have allergies, I have this, I have that, and they don't seem to be doing anything about it. Now let me ask you, out of all those symptoms you mentioned, which one is the one where, really you can go blind and where you have little, let me put it this way, which one is the one you can go blind? Let's answer that question first.
Well, the ones that you can go blind is definitely glaucoma, macular degeneration, and diabetes. Diabetic retinopathy can definitely cause blindness. All of the conditions that I mentioned are treated by early detection. A lot of the eye.
What you're saying here, Dr. Napolitano, what you're saying here is any one of the conditions, if you detect it early enough, you can prevent the blindness.
Not necessarily prevent it, but slow it down. Especially with, glaucoma, macular degeneration, and diabetes, you can certainly slow it down. Slow it down to the point where you get to retain vision versus becoming blind. That's a huge difference there. Glaucoma is a very slow progressing disease. It doesn't happen overnight. It could take over 10, 15 years to cause any vision loss. So going 10, 15 years without treatment, obviously the vision loss is going to be a lot higher than if you had your regular eye exam and we were able to discover that the glaucoma was there and to treat it early on.
Treating it early and constantly for those 15 years could make the difference between actually living longer, having your eyesight longer than your life versus the other way around, living longer than your eyesight, which wouldn't be
Correct.
a good thing,
Correct. Also like macular degeneration, which causes bleeding in this specific region of the retina, which is called the macula, and it's the point of the eye that allows us to fixate, that allows us to see that 20/29. There are two different types of macular degeneration. One of the kind is called wet macular degeneration, and it's called wet because usually we have some sort of bleeding there. And the key is to, if there is blood, to drain that blood as soon as possible before it becomes a scar. Once it becomes a scar, there's nothing we can do to restore the vision. But if we are able to notice the bleeding early on, nowadays we do have treatment to drain the blood and to try to stop it from occurring again. And that makes a huge difference in the vision outcome. Same thing with diabetes.
All right, Dr. Napolitano, we're going to go into each one of them much more in detail, so you can tell us of like how do people, detect it, like as it gets blur on the outside, blur on the inside, whatever it may be, so you can really explain it to us and explain to us, what we can do about it. Thank you very much for this, very enlightening, and speak to you soon.
Thank you.